So in my office, as part of being a holistic dentist, I'm well aware of the materials that we use to do our dental work. So, a lot of people are walking around with amalgam fillings or silver fillings or mercury fillings that have been in their mouth for a long time. My dad has been at the forefront of this where we have not used any silver fillings in our office, for well over 25 years. Number one, people don't want the color in their mouth, and two, there are health effects or impacts of having those materials in your mouth. The silver amalgam fillings are over 50% mercury, and the mercury is one of the most toxic materials in our environment. So when mercury is in our teeth, in our mouth, close to our brain, it's always emitting a vapor. When we chew, when we brush our teeth, and we know that people can have health issues or toxic reactions to that material, just like they can to mold or any other biotoxin that's in the environment. Even the Environmental Protection Agency in 2020, released something where all dental offices have to have separators in their water lines to catch and filter the mercury particles before they reach our streams and our environment and nature. So our government's telling us these materials are toxic to use in the environment, but for some reason they're safe to use in our teeth and our mouth and put close to the brain. It doesn't add up or make any sense. So because of that, when we remove those materials, or if somebody is tested for heavy metal or mercury toxicity, we need to be very careful and remove those in a safe manner. So we have special suctions, we have isolation devices, we have air filtration units, we give people chelating or detoxifying agents that they can use before and after the procedure. And this is done not only for your health, but my health and the health of my whole office and my team, since we're surrounded in this environment all day. A dental office is the only place in America that is unregulated for mercury. Again, how does that make any sense? So we can help people who are sick by removing them in a safe, effective manner, as outlined by the Academy of Oral and Medical Toxicology, the IAOMT. They have a protocol called the SMART, kind of safe mercury amalgam removal technique that we follow. And so what do we do when the fillings are taken out? That we replace them with tooth-colored biocompatible materials, materials that are proven to be safe and effective with our teeth, our enamel, our body, and don't emit any toxic chemicals. So, we don't use any metal or any of those materials in our office. It's composite, it's porcelain. We try to, remove them, in a manner where we can replace the tooth structure by conserving as much healthy tooth structure as possible. So do the treatment in the most conservative manner that we can.